Awesome. All right, well, welcome back to one of our mental health moments. We hope that you've enjoyed these. We hope that you've learned from them and things have been applicable to you. And actually, we hope that this is something that's resourceful. We really do, because we care about this community. We care about students. We care about the adults. And we want to make sure that everybody's helped with. Again, my name is David. I'm with Education for a Lifetime. And today, I have one of my friends, Heather Pelser, here with us from the Office of Suicide Prevention. And she's going to talk a little bit about what's going on. Heather, how are you doing today?
Hi, good. How are you?
Oh my goodness, I'm so excited to be like on a call with you. Like, this virtual world is so much fun because like we can kind of be a little bit of whatever we want to be. But I'm curious about you. Like, I mean, now that we're like have some of these like restrictions are kind of being pulled off, like have you been able to like reintegrate back to the office? Like, how's that been for you?
Yeah, I work for a community mental health agency in Pueblo called Health Solutions. I work under a grant through the Colorado Office of Suicide Prevention. So I noticed you said I was from there. And they're not bringing staff back until mid-May, but I was like, I gotta get out of the house. So I've actually been back at the office since last week.
Awesome. Like, I've been telling people, it's much like going back to school. Like, it's so like going back to school, right? Like, all of a sudden you're like going back to school and you're like, do I get a new backpack? Should I wear these new shoes? Like, what's my first day outfit gonna be? Like, how's that been for you?
My thing was I went in my office and I hadn't been in it in so long, and the maintenance here is fantastic, and it scrubbed everything. And so like my diploma was off the wall and some things are moved around. And I was like, who's been touching my stuff? Someone's been in my office. Like, I'm texting my boss and she's like, Heather, the maintenance guy washed the walls. Oh, sorry.
What?
But it's like, everything's not where I left it.
It's too many criminal shows that you've been watching. You've been watching all of them on Netflix, and you're like, someone took my stuff. Like, live PD, and you knew. You're like, something's up. Something's up. Oh my goodness.
What's going on? Yeah, but that's about it. But, it's been great to get up every day and shower and wear regular clothes, like nice clothes, and put makeup on and look like a human being again. That's been the best. It's really kind of helped my mental health and kind of getting back in a routine again. Like, I'm not just going from the bed to the couch. I actually drive down from Colorado Springs to Pueblo and have some time to listen to some music. And I feel much more normal now.
Yeah, there is a sense of that, right? Where you just have to like, what was that routine that I was used to that gives you some wellness? And I think that's what we've been trying to communicate through these mental health moments is like, there are things that are helpful, routines, protective factors, those types of things. I know there's a lot being discussed around COVID and Corona and what's happening with that. What have you seen from your lens in regards to what would be helpful for our community to know around suicide and mental health in our community during this time?
The one thing that I have been pleasantly surprised with that I think everybody, if they don't already know, should know, is there is a wealth of resources. Our community, El Paso County, has really just stepped up. I was kind of in the dark for a little bit, wallowing in aloneness in my house, going,
like many of us.
And then I started, asking people, hey, what's going on? And, oh, we should do this or we should do that. And they're like, oh, it's already done. It's being done here. It's being done there. So the one thing that's been the greatest is in regards to youth is that our school systems and all of our partner agencies have done so well connecting with these kids, making sure they have what they need and really kind of listening to them, pulling them into the conversation. So a lot of the decisions in the suicide prevention realm that we've been making in El Paso County have been youth-led, which has been awesome.
Yeah. That's very good. I mean, there have been a myriad of resources, and we've actually had the great opportunity and the honor to feature a lot of those resources through our mental health moments.
Right.
So we unfortunately, although all these resources are available, we still see the sadness of losing someone, and we've seen death by suicides happen in our community. How would you speak to that? What's going on with that?
Yeah, so that's been really difficult. As it is with suicides always, unless you know somebody or hear it through the grapevine, we really don't know how many suicides are actually occurring. Because you and I work in this realm, we tend to hear about them more. So, unfortunately, there have been some youth suicides during this time frame, which is extremely tragic.
Yeah.
It's very hard when we're kind of behind closed doors trying to figure out how to pivot to this virtual world. And, suicide prevention is what we do. And then we hear about these deaths and it becomes absolutely heartbreaking. And then you see more, okay, we really, the importance of our work, we need to keep doing this. But it's also important to take a step back and remember that this time frame, unfortunately, it's not just, COVID-19 is causing suicides. It's April, May, end of school year is a big contributing factor to youth suicides every year. And so we really need to keep that in perspective and look at, make sure we're taking care of all of those youth. And even, what's really cool with the state of Colorado is we define youth up to age 24.
Oh, wow.
So we've been looking at those young adults right now. A lot of them work in the service industry and they're no longer working.
Yeah.
We know there's been some tragedies at the Air Force Academy. So it's just really highlighted the importance of our work always.
Yeah.
And it's been so amazing how quickly everybody has pivoted to, hey, we're not stopping this work. We are just going to go full force with it and make sure we're out there and people know that there are resources. So it's been so heartwarming to watch. But, suicide does still exist, whether we hear about it in the media or not. And so we need to make sure we're aware always of warning signs and how to help people.
Yeah, as you talk about that, it's really this like, there's a lot of amazing stuff happen, and then there's this still devastating stuff that's happening. What are some of those resources for people that, like, you've seen that you're like, again, maybe you've seen them on our other mental health moments, but I think this is great for just a reminder, but what are some of the resources that you would recommend or refer to locally for individuals that are navigating that?
Right, so kind of touching, this is a little bit of a sidetrack, but I'm gonna come back to what you just asked me. I'm friends with Cass Walton, who is the executive director of Pikes Peak Suicide Prevention. We also worked together around. I watched her mental health moment as well. And she had mentioned they're getting a lot of calls from parents who are not used to seeing this side of their children, right? So we know that teenagers, those of us who work with teenagers, we know what kids are like on a regular basis, right? But some of these mental health, the depression, the loneliness, all those signs, that kind of thing, parents are like, oh my gosh, I don't know what to do with this, right? They're usually like seeing the kids hi, bye, in and out kind of thing. So as far as resources go, on Pikes Peak Suicide Prevention, I always direct people there. They've got support groups for teens, as well as for adults who are struggling with suicidal ideation. NAMI is a great resource in our community, right? I mean, and I know you had Emily on. NAMI has support groups for parents. We've got a great organization in town called Heartbeat, which has now virtual support groups for for adults who have lost someone to suicide. And this has been really triggering, right? So if you're going through grief during this, they're a great resource.
Glad you brought them up, because that's one of those ones that, especially during this time, like they're a great resource for those that have lost during this time and or have the anniversary coming up of somebody that's been lost. That's a really great resource. I'm glad you brought them up. They are phenomenal.
They really are. And I think we forget that, right? Because everybody's having to grieve while you're in isolation or quarantine. Everyth's compounded. And so to have an avenue like Heartbeat or Pikes Peak Suicide Prevention has a teen grief loss group, to be able to kind of say, hey, that this is hard, and to be with some other people who have gone through that. So that's a great resource. Of course, we're all partners with the El Paso County Department of Health, or Public Health and Environment. Our people have been kind of pivoted into other roles during COVID, but they're still in connection with all of us, and they've got a ton of resources. The schools have all been sending out a lot. I know you had Dan from Sources of Strength on. Sources of Strength. I mean, there's just so much. So there's a lot that's virtual, or a lot that's like web-based, but then there's also virtual groups where you can interact with people. I think anybody that you've had on in your mental health moments, people can contact, and we can kind of point them in the right direction.
That's well done, a great marketing ploy. I didn't even pay you for that. Well done. No, anybody that's been on are great resources, but there are more that will feature along the way. But even with what you just said, Heather, I think one of the things, and I'd like you to speak into this as we get to a close here, but like we're 8 weeks in and there's some reintegration process going on.
Right.
What should we be thinking about as people that are going back to kind of this new normal, but like what's that like? We don't want to forget some of this stuff because people navigated that. Like what should we be thinking about as we head into like transitioning into this new normal for us?
I think the biggest things for me, and I work in suicide prevention, so this is my daily life.
Yeah.
But one is connection. We've got to remember to look out for everybody, right? We need to check in on ourselves. We need to check in on each other. It's very lonely. We all have, the thing with this COVID thing and this quarantine is everybody has different emotions and feelings about it.
Right.
Good, some are bad, they're all over the place. And so everyone just really needs to be true kind of to their own feelings, but making sure we're checking out, watching each other.
Yeah.
And just, I think everybody kind of says this, but really emphasizing it's okay, like your shirt says, it's okay not to be okay. It's okay to say, you know what, I just can't do this today. or I'm having some anxiety, or I'm having some depression or whatnot. And to be able to talk about that and reach out to each other and just really I don't want anybody to ever feel like they have to hide it.
Yeah.
Like, we're all there. I struggle with my own depression. I have developed this fun little thing that's called stress hives. I don't know if anybody has that. But I have an amazing boss, and I'm able to be like, oh my gosh, this is what's going on today, and really kind of have those conversations and not have to hide anything. And I think just remembering too that the work continues, that we have proven through this time, one, that we can get through this.
Yeah. Yeah.
We can get through change, and we can get through change that happens immediately. We all, we're pushing through, and that we know that from now on, that's going to be this constant state of change. And you know what? All these services, all these programs, all of us, we're all just rolling with the changes, and that nothing's going away, nothing's disappearing. We just kind of come out louder and stronger, which is awesome.
Which is really what we're trying to promote in individuals to build resiliency. One of the greatest ways to navigate any of these emotions and the things that we're going through is to have those coping skills to build resiliency.
Right.
And to build resiliency to change during those things and change with those obstacles. I love that you said to think about connectedness. One of the things I've been thinking about is, well, now when we go back all to normal, we'll be like, oh, that like it never happened. But the reality is it still happened, and we still have these emotions, and they may come up, and they may be activated at some time that you don't even know. It's unknown. And so we're going to recommend, hey, keep getting involved and keep reaching out to those resources. I love what you said. Don't stay silent about it. Don't mask this. Don't pretend like it didn't happen. And if there are emotions, be honest with your emotions and engage in conversation with those emotions. So thank you so much for taking the time to jump on here. We love what you do. We love having you as a partner in our community. So Heather, thank you so much. Thank you for being the hub of resources as in our community. We love that. And man, enjoy your drives. Enjoy your drive. Enjoy getting ready for the day. What a great feeling. And if you took anything away from today, just get ready. Just get ready for the day.
Just put on something other than a hoodie. You'll be good.
There you go. And that'll end our time together. Heather, we'll see you out in the community, hopefully in person sooner than later.
Yes.
So thank you so much. All right.